Well, good afternoon. The fight against COVID-19 is like nothing we've ever faced. In a fight like this, you need every tool possible. You need to mobilize every resource available. That's why I'm here today, to personally inspect the latest addition to our fight against this terrible virus. In a few short weeks, this hospital, the Cortellucci Vaughan Hospital, will open its doors. It's the first newly built hospital in Ontario in over 30 years, adding net new capacity to the system. And when we're in the fight of our lives, this incredible state-of-the-art hospital, it's like reinforcements coming over the hill. This new hospital, it's a rare of hope and for all of our incredible healthcare heroes in the front lines of this fight. With many of our hospital ICUs approaching full capacity or beyond, this new hospital, it's relief, it's added capacity for all those heroes who are stretched to the limit right now. That's because working with Altaf and his team, I have to tell you, Altaf is an absolute champion. This guy has hit the ball out of the park, and I told him today that ball's still going for stepping up like this. We've decided that Cortellucci Vaughan Hospital will open as a dedicated resource to support the province's COVID-19 response. This hospital will take in critical care patients from surrounding hospitals to help ease capacity pressures around COVID-19. Again, I want to thank Altaf and the entire team at Mackenzie Health for stepping up to the plate at this time when we need it most. Today, I can also announce that we're investing $125 million to get 500 additional surge beds in Toronto, Windsor, Durham, Kingston, and Ottawa. These 500 new beds will reduce pressures on hospitals in these hotspot regions as we battle COVID-19. This is in addition to the 3,100 surge beds we added as part of our COVID-19 response. I'd like to recognize and thank Mayor Bevilacqua and Ministers Lecce and Tabolo for their leadership here in Vaughan and all of their work getting this hospital off the ground. And above all, I want to thank all of the frontline workers, the nurses, the PSWs, the doctors, paramedics, and hospital staff at Mackenzie Health. These local heroes have been working around the clock to provide top-notch patient care over the past few months. My friends, this is Canada's very first smart hospital. It's a spectacular addition to Ontario's healthcare system, and we can't stop here. We're investing $18 billion over the next 10 years to build new hospitals right across Ontario. But my friends, the fight isn't over yet. And as I've said before, we will be here. We will do whatever it takes. We will spare no expense to keep you and your family safe. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier. Our government is using every tool at our disposal to support our hospitals as they respond to COVID-19. That's why we invested an additional $2.5 billion in our hospitals this year. This includes the creation of more than 3,100 new beds in hospitals and alternate health facilities across the province. And today, we are pleased to announce that we are providing $125 million to add over 500 critical care beds to hospitals in hotspot regions. We are working with Ontario Health to select these hospitals with the primary criteria focused on their physical capacity to add beds and the availability of healthcare workers to staff them. This critical first step starts today at Mackenzie Health's Cortellucci Vaughan Hospital. At the request of the province, the Cortellucci Vaughan Hospital will temporarily transition into a system-wide resource supporting the province's COVID-19 response when the new hospital opens next month. As the Premier mentioned, the Cortellucci Vaughan Hospital will provide a total of 185 additional beds, including over 35 critical care beds and 150 general medicine beds to support non-critical patients from other hospitals. Currently operated services will remain at the Mackenzie Richmond Hill Hospital site. Once COVID-19 capacity pressures have stabilized, the new hospital will fully open as originally planned to provide care and services to patients from across the Western York region. We're also amending the necessary regulations to allow hospitals to temporarily redeploy staff to other hospitals or retirement homes that urgently need additional support. We previously made this change, allowing hospital staff to work in long-term care homes. These steps will help to alleviate capacity pressures being faced by hospitals, allowing our healthcare system to work more seamlessly and effectively to keep Ontarians safe. We will continue to work together with all our hospitals and healthcare partners to care and protect everyone affected by this deadly virus. Again, until vaccines are widely available, I strongly urge everyone to only go out if absolutely necessary, if you can't work from home, to get groceries, pick up a prescription, or attend a medical appointment. Please also continue following the public health measures and stay home, stay safe, and save lives. Thank you. And now I'd like to invite Altaf Steshonwala, President and CEO of Mackenzie Health, to the podium.
Thank you, Minister Elliott. Cortellucci Vaughan Hospital opens in a few short weeks. It was always intended to be a tangible solution to ending hallway medicine. COVID-19 cases are rising at an alarming rate. Hospitals have reached their capacity limits and are forced to transfer patients across the province. Now more than ever, we're proud to support the greater healthcare system. When Cortellucci Vaughan Hospital opens in February, our focus will be on creating ICU and acute care capacity to support the COVID crisis and hospitals across the GTA. The emergency department will not open until the COVID surge has been addressed. Our emergency department at Mackenzie Richmond Hill Hospital remains open to support our community as it always has. Once the system has stabilized, Mackenzie Health will fully realize our two-hospital future. This is a different opening than we committed to our staff, physicians, and community. But we know it's the right thing to do for our community and our province. I want to thank our government, our staff, physicians, and volunteers, donors, partners, and the broader community. You've all worked so hard to make Cortellucci Vaughan Hospital a reality. Thank you. I would now like to invite Vaughan Mayor Mauricio Bevilacqua to the podium. He's also the chair of our $250 million Ultimate campaign. Mr. Mayor.
Thank you, Altaf. COVID-19 is a marathon, not a sprint. Patience, discipline, and perseverance are required to defeat COVID-19. In this journey, we must continue to share a common purpose and pool our resources together, and this is precisely what we are doing here in the City of Vaughan today. The Cortellucci Vaughan Hospital will open its doors in a few short weeks and address the critical need for ICU beds in this province when the need is greatest. The City of Vaughan remains committed to working together with the province, public health officials, and citizens to stop the spread, save lives, and protect our hospital's capacity. Premier, I want to express my gratitude to you, your cabinet, and your team for addressing the evolving challenges facing Ontarians since the onset of this global pandemic. By working together, using our intelligence, common sense, and by exercising personal responsibility for the greater public good, we will emerge stronger. At this time, I would like to invite the Honourable Stephen Lecce, Minister of Education and the MPP for King Vaughan, to the podium. Minister.
Good afternoon, and thank you, Mayor, for the introduction. Now, throughout this pandemic, when our province faced incredible difficulty, it was our community that stepped up to produce the first Made in Ontario PPE. We stepped up to donate generously to programs that support the most vulnerable right across the GTA. And today, when faced with this invisible threat afflicting the entire world, it is our community, our families and citizens banding together to ensure we can defeat this disease. It is Vaughan stepping up yet again to help save lives with the opening of the Cortellucci Vaughan Hospital that will support a system-wide and regional response to combating COVID-19. As the Premier noted, 185 additional beds, 35 critical care beds, 150 general medicine beds, all opening for February 7th. All to help those among us, our parents and brothers or sisters, our grandparents and our neighbors who contract this disease to get the best care possible, exceptional care in a state-of-the-art hospital. I want to thank every frontline worker and to the hospital administration of the Cortellucci Vaughan Hospital and Mackenzie Hospital. Thank you to the City for your partnership, to our Premier and the Minister of Health for your personal commitment to delivering this critical hospital to our community. And thank you, most especially to the people of Vaughan, for always stepping up and for standing out. You represent the very best of our country and the Ontario spirit that inspires us to continue to work hard and together so we will defeat this disease. And now I want to call back up the Premier to answer questions. Thank you.
We'll go to the phone line for questions. First question, please.
From Jeff Gray at the Globe and Mail.
Hi, Jeff.
Hi, thanks. Hi, everybody. I wanted to ask, I know you've expressed frustration, obviously, in the last several months, the vaccine issue, the supply crunch, but I understand because of that, the province is now saying that there are no more first doses for anyone outside of long-term care homes or high-risk retirement homes for the time being. So what do you say to the staff in the ICU wards outside the GTA in Windsor who now are just finding out that they're not going to be getting their shots anytime soon?
Well, we're working and doing everything we can with the federal government to work with Pfizer to get the vaccines that we need. It's absolutely critical, and I understand their concerns. Right now, we're working in conjunction and collaboration with the federal government. And so I guess someone's going to have to, as I asked the Prime Minister, when we can expect it. And I have all the confidence in the world in the Prime Minister working his back off with Pfizer to get this done. We still have the Moderna, and I will pass this over to the Minister of Health to follow up.
Well, we are doing everything that we can to work with the federal government to receive more supplies, but the fact is that Pfizer is doing some retooling at their plant in Belgium, and so we will see our supplies reduced for a period of time. However, we know that we need to protect our most vulnerable citizens, our residents of long-term care homes and high-risk retirement homes. This is a pledge that we made to them from the beginning. That is why we're concentrating our attentions there first and foremost. And then, of course, our healthcare workers are also very important in those locations and in hospital locations. So as soon as we have those vaccines, that's where they're going to go.
Follow up?
Thanks. And just back to the 500 new critical care beds. I don't know if the Premier or the Minister of Health would like to answer this, or both of you. The question is, when can we realistically expect those beds to be in operation? I assume it includes the 35 that we're going to have in a couple of weeks, right where you guys are. But you've got to find staff and space. That's going to take weeks, months? How long will it be before all 500 of those beds are up and running?
Before I send it to the Minister of Health and over to Altaf, I'm going to give Altaf another shout out, you know, and the people of Vaughan and the Mayor. They have, you know, gone above and beyond the call of duty. And you've heard me many times call out the Trilliums, the UHNs and Sunnybrook and everyone else. But this is a massive call out for the people of Vaughan. Thank you for stepping up. You're making a difference right across Ontario. And I'll never forget, I called Altaf, I think a week or 2 weeks ago. How are things? How's the hospital coming along? And he was speaking with Ontario Health, working with the Minister's office, I'm sure the Mayor. And he said, you know, we're going to be there to support you. And as I say, a lot of hospitals and CEOs have knocked it out of the park. Altaf, you've knocked it out of the park. And, you know, as I told him earlier, and I said it earlier, but that ball's still going. This is going to make a massive, massive difference with capacity. So again, I want to thank Altaf, his whole team, for allowing us to be here today. And folks, I took a tour, talk about state of the art, is just unbelievable. First smart hospital anywhere in the country, and the technology is staggering. When you go into each room, a staff member, they sanitize their hands, it automatically reads the badge, and it will show what person walked in the room and who sanitized their hands. It's just absolutely incredible. I'll pass it over to the Minister of Health and then over to the CEO.
Well, the reality is we don't have months to wait for these beds to come online, because this is a serious capacity challenge that our hospitals in Ontario are experiencing right now. Even today, we have people who are being transferred from hospitals in Toronto to Kingston and to Niagara. So this is not something that can continue for a long period of time. So what we are looking at doing, in addition to the great facilities here at Cortellucci Vaughan, is looking at space that other hospitals already have in their physical premises, spaces that haven't been used for beds for a period of time. We want to open beds up there because the premises are already there and they have the facilities to be able to open critical care beds. We're also looking at creating step-down units for people that don't need to be in a critical care bed. They can be at a step lower. We can create those in other hospitals, and we're also looking at hospitals that are perhaps rehabilitation hospitals or do other work normally, but they also have the ability to create some critical care beds. So we're looking everywhere that we can within the entire system, particularly in the hotspots, to create those beds. But the units that are opening up here at Cortellucci Vaughan, the 35 critical care beds here and the 150 medicine beds, are going to make a significant difference.
So thank you, Mr. Elliott. Obviously, we can continue to add capacity at this hospital. So as an example, we're not opening the emerge department because we have the ability to create another 24 ICU beds in that emerge department. Obviously, we continue to look for staffing, we continue to recruit. And what I would say, I've never in my entire sort of career as a healthcare leader seen the system come together as it has in the last number of months, in the last year and a half. You know, with this IMS structure that moves patients across the region, we actually come together as hospitals so that we can share the crisis and share the capacity challenges. So it is quite remarkable how all the CEOs and all the hospitals are working together to level load capacity so that we work together as Team Ontario. And obviously this is another addition of capacity that will help the GTA.
Next question.
From Lucas Meyer, News Talk 1010.
Hi, Lucas.
Thank you very much. So just to follow up on Jeff's question, so what is the earliest we will see these critical care beds come online? And Minister Elliott, maybe you can address this. What does this mean for, getting to, things like field hospitals, if it's going to take, however long it's going to take for these hundreds of beds to come online? How many field hospitals or those outside facilities should we expect to see over the next, month or two or three?
Well, no, we're looking at adding capacity as soon as we can, and in some of the hospitals they may be able to open those critical care beds very quickly because they already have the facilities to be able to do that. It may have been space that has been closed off for a period of time that they can open that up. Every single additional critical care bed is going to make a difference. We've got 35 beds opening up here at Cortellucci Vaughan on February 7th, and we have been in discussions with the federal government for 2 field hospitals as well to be able to move people who might not need to be in a critical care bed to be in another location. So there's a lot of shifting and movement that needs to happen, as well as dealing with all of the health human resources, which is another one of our biggest impediments. So that's why we're looking at redeploying trained staff from other hospitals in non-COVID related areas into the hotspots. So we need all hands on deck. There are 1,000 moving parts in all of this, but it's all happening very, very quickly because we know that the need is great and it's significant.
Follow-up?
Well, and if you could also address, Minister, what we should expect in terms of those outside, field hospitals, resources, if you could elaborate on that. But also, Toronto's Chief Medical Officer of Health, Dr. Eileen de Villa, mentioned today that because of the Pfizer delay, that can mean a 20 to 80% reduction in the delivery of vaccines in the city. Are you seeing that as well, and do you expect that to be across the province as well, not just Toronto, but 20 to 80% across the province as well?
Well, first of all, dealing with the question about the field hospitals, they are coming online. We are working with the federal government to get them operational. That shouldn't take very long to happen at all because we know that the need is great. It's urgent. So we're working with all hands on deck to get that moving forward. With respect to the Pfizer shipments, we know that the next 2 shipments, one is going to be 20% less. The shipment after that will be 80%. Fewer vaccines, but those are until we get into the month of March. Very early on, late February, early March, we're going to be receiving larger doses of vaccines coming in. So this is a very temporary situation. It has to do with the amounts that we receive from Pfizer through the federal government. This will affect across the province shipments and receipt of vaccines.
Next question.
Mike Crawley, CBC News.
Hi, Mike.
Hi. Either Minister Elliott or Premier or perhaps Mr. Stashawala could clarify the 185 beds at the hospital. I don't actually see in the news release that it says that they are dedicated specifically to COVID patients. Could you clarify whether you're taking all patients in? Because there seems to have been a message that this is as a dedicated hospital for the pandemic response. It seemed to give us an impression that it's only going to be for patients who are COVID positive. So could you please clarify that?
Sure. Good question, Mike. I'll pass to the minister and over to Altaf too.
Well, there will be 35 critical care beds opening here at Cortellucci Vaughan and 150 medicine beds, but the idea is that this hospital is going to be used, as Mr. Stashawala has said, in order to be able to help take the load off some of the other hospitals that are experiencing capacity challenges, and I'll ask Mr. Stashawala to come and speak to that specifically.
So thank you, Minister Elliott. So what is important about the model that we've suggested, as you know, we're not opening the emergency department, to create more physical capacity, but also to ensure that the key intake for this hospital continues to be the IMS structure that's been put in place across the province. This is a structure that's led by Dr. Andrew Baker from St. Michael's Hospital, and it ensures that the level loading across the GTA, which is the most challenged, will continue to be the sole source of intake for this hospital. So we're dedicated to supporting the hospitals around us as they see more capacity challenges to level load case volume across the GTA.
Follow-up?
I'm not sure I got an actual clear answer as to the simple question, is it or is it not for COVID-only patients? But I have to ask another question on behalf of one of my colleagues. Seniors who are not living in long-term care make up a significant portion of the people who died in Ontario from, and yet they're not one of the government's rollout. Could you give some sort of a justification for why seniors who are not living in care are not one of these priority groups, and explain why they're not further towards the front of the line?
Well, as we've said right from the beginning, Mike, we're taking care of all long-term care patients in the hot zones and the staff as well. And then we have to take care of the frontline healthcare workers as well, move it across the province. But make no mistake about it, our seniors are a priority. They're the ones that built this province, built this country. And I believe the General is with them when he answered this question before. They're going to break it down to age, I guess start with 90, then down to 85 or 80, and so on and so forth. But I'll pass it to the Minister of Health. Thank you.
Well, all of our seniors are very important, whether they're in long-term care homes or retirement homes or whether they still live at home. But the reality is we've had a surge in cases in our long-term care homes. We've had many people tragically pass away. And so we know that they are required to live in relatively close quarters. That's one of the ways that this gets spread, and they have people coming in to see them that bring it in. It doesn't just happen, it's brought into them. So they don't have the ability to stay at home and stay safe if they live alone, with some people bringing them food and medication, as some of our other seniors do. That's why we've targeted this group of seniors in long-term care homes and high-risk retirement homes, first of all, but everyone is important. And as the Premier said, once we start receiving a larger supply of vaccines, we are then going to be moving to adults who have home care requirements, and also starting with adults that are 80 years and over, and then moving it down in 5-year increments. So everyone is important, but it's just related to the supply of vaccines right now.
Next question.
From Sean Jeffords at the Canadian Press. Please go ahead.
How you doing, Sean?
Oh, hi, everyone. I think I want to try and get a bit of clarification on Mike Crowley's question there. So it sounds as if patients who are going to be coming to the hospital in Vaughan are not just going to be COVID patients, but they're going to be patients who have to be transferred because of capacity issues generally because of the pandemic. Is that correct?
I'll pass that over to the Minister of Health or Altaf, either one.
The IMS structure is moving COVID GIM and ICU patients exclusively over the last number of weeks. So that will be the type of patient that comes to Cortellucci Vaughan Hospital. Over the last number of weeks, the exclusive movement has been ICU patients. So based on how that modeling works and based on how that table moves patients around, that will dictate the kinds of patients we receive.
Follow-up?
And on another subject, Premier Ford, I wanted to ask you about a recommendation that the Toronto Board of Health made today about paid sick days. Now, I know you've been asked about this a number of times over the course of the pandemic. I'm trying to understand why your government seems resistant to, giving more paid, especially when so this would help workers stay home, especially can't afford to otherwise, which would then help break, alleviate workplace outbreaks in the system. So why not give more paid sick days to workers?
Well, it's a good question. So when we negotiated, the premiers negotiated, myself negotiated the Restart program with the federal government. They put up $1.1 billion. Out of that $1.1 billion, only $270 million has been taken out of that. So if the system's not working, and that's what I'm hearing from the media, we're having conversations as we speak and over the last little while with the federal government, maybe to change it. If people don't feel they're getting it quick enough, which I've brought to the attention of the Prime Minister and Deputy Prime Minister, then we need to change the program. If they need to top it up a little more because $500 a week isn't feasible, then we change it. But let's be very, very clear. There's no reason for the province to jump in there when less than 27% of the overall program hasn't been taken up. Does it need to be changed? Sure, it needs to be changed, and we're working with the federal government, but there's no reason for us to duplicate the $1.1 billion with the federal government, and I know the federal government's going to be reviewing it, and hopefully we'll have an answer in a very short time here.
Last question.
From Adgel Biman at Global News. Please go ahead.
Hi, how you doing?
Hi, Premier. Thanks for taking my question. I'm wondering on the Pfizer delivery schedule, what's your reaction as to why Canada will be set back for a month while the EU will get back to their original delivery schedule by next week? And can you be specific about what that impact from Pfizer specifically has on Ontario's vaccination plan?
Well, I can't answer the conversations with Pfizer and the federal government. That's a question that the Prime Minister is going to have to answer, but the impact is huge. It goes, as the Minister said, it goes from 20% reduction up to 50 down %. That's going to be a massive, massive impact. And if you go back to the beginning of this, and this was our concern at the beginning, if anything were to happen, some people are criticizing, why are we holding it back? That was the reason we're holding it back. You never know what's going to happen. It was a good decision by the Minister and General Hilliard to do that. Do we wish we would have held back a little more? Sure we do. But we still have the Moderna coming in, and I just asked the federal government, which I have confidence in, and they're working hard to really put pressure on Pfizer right now. And why should someone jump ahead of Canada? And going back, if there's one thing that I wish we could have done, it's all hindsight, with a massive industry, pharmaceutical industry we have here in Ontario, one of the largest in North America. You know something? We need to start making our own vaccine. God forbid this ever happens again. Rather than, it goes back to the PPE, rather than rely on other people around the world to dictate what we get, I think the power of Ontario and Canada as a whole, there's no reason we shouldn't be able to have our own vaccine in the future. Thank you.
Follow up? Abigail?
That's all right.
Okay, thanks everyone.
Thank you, everyone. And again, thank you, the people of Vaughan, Altaf, and the Mayor, Minister. This is an amazing, amazing hospital. Thank you. God bless.